feel it's important that the public knows what kind of drugs are on our street.
Advocates have released information on how many people died last year from drug overdoses in Manitoba after the provincial government refused to release that data. Arlene Lass-Kolb lost her son Jesse in 2014 due to a fentanyl overdose. He was just 24 years old.
He was the love of our life. He was everything to us.
Lass-Kolb has been advocating to reverse overdose trends since her son passed away 8 years ago. However, she says the numbers are only getting worse. In 2020, there were 372 overdose deaths in Manitoba. That number jumped to 424 deaths in 2021. However, the province has not released the numbers for 2022. Lass-Kolb is part of the advocacy group called Moms Stop the Harm. The group was able to obtain data from the Chief Medical Examiner's office, which shows there were at least 377 deaths in the first 11 months of 2022.
Right now, our numbers are out of control.
A government spokesperson tells City News that the province, quote, does not provide or report on preliminary or incomplete information. But Lass-Kolb says the government should be transparent and let the public know what's circulating on the streets.
I'm pretty angry because they've had plenty of opportunity to do different things.
From January 2016 to June 2022, there were 32,632 opioid-related deaths in Canada. Marion Willis from St. Boniface StreetLink says the number of overdose deaths, specifically those in Manitoba, are unfortunately far worse than what is being reported.
I'll just keep saying it until we move the focus there. We're never going to get ahead of this.
The current Manitoba government has refused to support and fund supervised drug consumption sites. Willis says while she recognizes the pros and cons of supervised consumption sites, instead of having the province decide what needs to be done, she wants more input from the drug-using population.
We actually need a strategy, and I can't say that enough. We still don't have a strategy. If you don't have a strategy, you have no system of care. You have no way to measure any kind of outcomes. And the people who should be informing the strategy are the people who use substances.
Lass-Kolb says failed drug policies and a lack of government response is continuing to impact families and communities and will continue to do so if nothing changes.
We have to do something else. We will never treatment our way out of a toxic drug supply.
In Winnipeg, Karpa, City News.